In this segment, I'm going to talk to you about a gene family called cytochrome P450s. So cytochrome P450 genes encode enzymes which are responsible for phase 1 of the drug metabolism process. You've heard about the phases of drug metabolism in another segment, but the cytochrome P450s are the primary gene group responsible for the phase 1 drug metabolism. They catalyze a variety of oxidation and some reduction reactions. The genes are expressed throughout the body, but the primary place that cytochrome P450s are prevalent is in the liver. So specifically, they can be found in the membranes of the endoplasmic reticulum in hepatocytes or liver cells. So these genes use heme ions to oxidize molecules. That's why they're responsible for most of the oxidation of drugs. The main functions of cytochrome P450 overall are twofold. One, they're responsible for biosynthesis in the body of endogenous chemicals like steroids, bile acids, fatty acids. They're also responsible for the metabolism of a lot of endogenous chemicals, such as cholesterol. So it's estimated that there are about 14 cytochrome P450s involved in the arachidonic cascade, about 7 in cholesterol metabolism and bile acid biosynthesis, and about 4 in vitamin D synthesis and metabolism. But the primary reason I'm talking to you right now about cytochrome P450s is because of their role in metabolizing exogenous substrates, such as drugs or medications. So I'm going to take a minute to talk about the nomenclature for cytochrome P450s. It's important to understand how these genes are named so that it makes sense to you when we're talking about all the CYPs. The superfamily is the cytochrome P450. And then this is a combination, basically, of letters and numbers to designate what the gene name is. Oh, and I should point out that CYP, you'll hear me refer to these, a lot of people refer to cytochrome P450s as CYP genes. If you take the CY from cytochrome, the P from P450, you get CYP. And so that's where that comes from. So the nomenclature is pretty systematic. It's a combination of letters and numbers. The family is designated by the first number. Then you have a subfamily designation with the letter, and then the isoenzyme with another number. So the gene name in this case is cytochrome P450 2D6, or CYP 2D6. So it's this part right here. The nomenclature for variation, allele variation in cytochrome P450s is a little bit convoluted. They use something called a star system. I'm going to go into a little bit more detail about the star system in a second. But you can see here in this example, we have a star 4. So people who are trained in this area find the star system really useful. But for other people who aren't familiar with it, sometimes it seems like people are talking in a secret code about the gene. As genomics becomes more mainstream and patients and doctors, clinicians have more access to this type of information, there's a push to get rid of this star nomenclature system. There are other reasons for it too, because these star alleles are specific combinations of variants in the gene. And as we go more towards whole genome sequencing and find more and more variation and more rare variation across the gene, the star nomenclature might become obsolete because of that. But there's a lot of reluctance from the experts in the field to let it go. So I'm going to tell you a little bit about what star alleles are. So basically, when you have the gene name and you see the star, the number following the star and the number is just a way, it's like shorthand to refer to particular variation across the entire gene. Sometimes the variation in that gene is just one SNP or one amino acid change, and it gets a star allele name. But a lot of times the star allele can refer to multiple variants, like a haplotype on that particular gene. And it can be multiple variants spread across the entire region of the gene. Sometimes the star allele can refer to complete absence of the gene. And sometimes the star allele refers to really complex gene rearrangements like translocations and things like that. So I'm going to give you an example. This is a spreadsheet, a part of the variation in CYP2D6, in the gene CYP2D6. So down the left-hand side here, we have a bunch of star allele designations. I've skipped some of them. I go from star 1 straight to star 5, and then there's a bunch listed down the side. And then across the top, I have the RSIDs and the changes, the nucleotide changes or amino acid changes for particular variations in this gene. And this is like a grid to show you, in the first row, star 1 is considered the wild type form of CYP2D6. And for each of these locations, each of these potential changes in the gene, I give you what star 1 has at that particular location. So in the first location that we're talking about here, it has a G, then a T, and so on. The red, anything in the red, is a change from the wild type position. So if there's a blank cell, we don't really know what's at that position in that particular star allele. We assume it's wild type, but the fact is that that position is not usually assayed when trying to assign a particular star allele. So we don't really know what is there. Here's an example of CYP2D6 star 5. It is an entire gene deletion. So the entire gene is gone. And so instead of people saying the CYP2D6 gene deletion over and over again, they just say star 5. Here I'm highlighting star 10b, so CYP2D6 star 10b. You can see there's several variants across the gene. There's an A change here, a G here, an A here. There's an insertion. So the combination of all these variants together found on CYP2D6 is what would trigger a designation as a star 10b allele. If you look at any given particular location on CYP2D6, you can see that the same change can be present in multiple star alleles. So in this particular case, RS16947, the G is changed to an A in a whole bunch of different star alleles, in star 8, and star 10, and star 11. So there are many places that there's that particular change from the G to the A. So that means to be certain about what star allele you're dealing with, you have to test really all the positions across the gene. For example, this particular change, if you just assayed for this change, this RSID, looking for a G to A, you wouldn't really know what star allele you had. You couldn't base an assignment on that alone. So that's important to understand that with a lot of these cytochrome P450s, you can't always give a designation just by testing 1 or even 2 positions. In theory, what you would like to do is test all the positions that are known, have any kind of known variation across the entire gene to be sure what's there and what star allele name it should be given. But that rarely happens unless you're sequencing. Sequencing is becoming more common because this particular gene is very complicated with many, many different variants. So it is becoming more common, and it really is ultimately going to be necessary to be 100% sure about what variation you have in that particular gene. But right now, we're still a lot of times basing star allele designations on genotyping. So it's just important to get the star allele designation correct because different star alleles have different levels of function, from normal function to absent activity to very high activity in some cases. And the function of the gene affects the patient phenotype and therefore affects the PGX of the drugs. Okay, so this is a pie chart of a bunch of different cytochrome P450s found in the body. The highest expressed forms in the liver are CYP3A4, 2C9, 2C8, 2E1, 1A2, and I believe 3A5. 3A5 is less abundant, 2A6, 2D6, 2B6, 2C19, a little bit less than the other ones. The 2J2 family over here, oops, sorry. Well, the 2J2, 1A1, and 1B1 families are mainly expressed outside of the liver. So, as I said before, there's expression throughout the body of cytochrome P450s, but the majority are expressed hepatically. There are a lot of things that influence expression of these genes. They can be induced by xenobiotics, sometimes hormones, cytokines. Disease states can also affect expression of cytochrome P450s, as well as sex, age, and the other factors. So I'm going to primarily talk about CYP1, 2, and 3. Those families metabolize the majority of drugs in clinical use today. There's 2 or 3, depending on how you look at it, different ways that CYPs influence drug response. The first way is they can convert a drug to an active metabolite. This is the case with the drugs such as clopidogrel. You've heard about clopidogrel in a different segment. It needs to be metabolized into an active form before it can do its job in the body. So CYP2C19 is responsible for metabolizing clopidogrel into that active form. Similarly, some drugs are prodrugs in the body and need to be metabolized into just the drug form. You heard about this in a different segment with CYP2D6 and codeine. Codeine is considered a prodrug. It needs to be metabolized in the body into morphine, which is a drug in its own right, and morphine is what's active in the body. So these two cases are very similar. One's, you're talking about a drug to active metabolite, one's a prodrug to the drug. It's almost the same thing. And then the other way CYPs influence drug metabolism is a lot of times they will inactivate a drug and kind of prep it for excretion. So basically, the cytochrome P450 is clearing the drug from the body, getting rid of the active form of the drug. It's kind of the flip side. And gene variation, or these star alleles that we talked about, affect these functions, the ability of the cytochrome P450s to perform these functions.